really excited also to be talking about the research that I do, which is hope. And so placemaking and the investment in hope in communities. This is a critical question that I think we constantly have to ask ourselves in terms of how do we close those gaps by asking, where would we like to see our future? I came of age in the time of Arundhati Roy's statement about another world is possible. And so I would like for you all just to take a moment and to think about, what does it mean for you to live in a community where everyone and everything and everywhere thrives in that community? What does that look like? And then once you have that space in your mind, what is hope and equity? Those two, holding those two forces together. Equity, we just had a wonderful definition of what it was, of not only being fair and just in communities, but making sure that all of the aspects that would cause injustice are also closed. And hope, with hope there is also a definition. It comes from both the cognitive, of it being agency, one's willpower to do something, and the experiential, one's pathway. So what is one's way power? You can have the will, but if the way is not there, hope is for naught. So do you all have those spaces in your mind? Great. So in thinking about the landscape of public health, I think it has been very easy over the past, I would say 10 years, for us to be thinking about problems, policies, and practices in the context of if this is what public health looks like. If public health looks like homelessness and housing dilapidation or cancer in our communities due to coal ash and environmental sludge, a lot of policymakers as well as public health officials have started to tackle that area around the social determinants of health. We need to be thinking about our built environment and how critically important that is for health and for hope, that agency and that pathway. An area that is recent to understanding what these social determinants are is really digging deeper to saying, how did those areas or those landscapes get to be that way in those particular communities? What are those systems of power that have constructed those landscapes to cause people's health to be so embodied? So if we have, here you see different images of people being excluded in their particular society, whether that be at the border of countries, I will make that plural, whether that be their spaces of faith and worship, a very spiritual and a practice that is embodied in a lot of people's both mental and social capacities, and those spaces, those spatial boundaries and places in which they go to experience that are then defamed. Or whether that even be in the physical skin that one has to represent in every single day, and how that is about the telling and the told of that particular body and that story. I will point out here, this image at the top is from your country. I think I, too, am governed by Alonzo's laws. So as I shared before, I have really been working in this space for a very long time, even before coming to municipal government, of how do you hold the both structural barriers and the stories of a critical mass, and do that very micro level work of gaining and attracting the stories of what's happening in the home, all the way up to how can you change laws and policies and the structures in which we all have to operate. And so as a result of not only what we were working on collectively through the Robert Wood Johnson Foundation Culture of Health Prize, but we also had really been building on this essence of health equity reports and capturing the data. And so when I was at the city of Louisville as the director for the Center for Health Equity, the report that was produced, and actually is a very, very thick report that can be found online at healthequityreport.com, but really looked at 11 different social determinants and mapped those to 26 different health outcomes. And how can those health outcomes actually be disentangled a little bit more as we think about not only the social determinants, but those systems of power that might be influencing those social determinants. And so Walter Woods came on to the Humana Foundation in 2017 at the end of that year and said, you know, the work that you're doing in Louisville to really build health equity in terms of not only how are we measuring the gaps, but how are we closing the gaps, Humana Foundation is shifting their strategy. Over a 30-year-old health foundation in the States, shifting a strategy to talk about health equity in specific communities, urban communities of practice in the United States. And so these are the communities that we work in, and I was asked to come over and do that research for the Humana Foundation. And so we're in Baton Rouge, Louisiana, Broward County, Florida, Jacksonville, Florida, Tampa Bay, Florida, Knoxville, Tennessee, Louisville, Kentucky, which is our headquarters, New Orleans, Louisiana, and San Antonio, Texas. And right now, these are the 8 communities. Hopefully there will be more to come. But really having alignment and synergy around what is happening in the private space or the sector that our endowment comes from is the health insurance company, Humana. And Humana is really shifting to be more of a well-being company and not just a payer of health, but how do they focus on really health in communities. And so Bold Goal is a strategy that was started about 4 years ago to really look at how to improve health in those communities by 2020, 20% of health by 2020. And so the Humana Foundation, we get to layer on top of what is happening in the private space with what we can do for public health in all of these different communities that have very diverse populations, have their own DNA as a community. And so how important is that to really understand the culture of a community and then to really have targeted impact on what those social determinants are that need to shift. So I know that I'm in the UK, so this is just kind of a map of where those communities are, and they're primarily focused in the southeastern corridor of the United States. And so I like to point out that it is the Southeast United States because I think of the very entrenched history that we have in the U.S. Around the South and what South means to race and racism and those other systems of power that co-construct what culture looks like, what systems look like in communities. And so we really work to improve communities through their leadership, culture, and the systems to sustain positive health outcomes. So there are 5 lessons that I'll run through really quickly that we've learned through, or I've learned through this work so far, and that is that these collaborations have to be multisectoral and at multiple levels. And so with the socio-ecological model, we know that working in the policy space is going to have the most impact for health in communities. But we cannot divorce ourselves from recognizing that the lived experience and the knowledge of an individual about their health is just as important. So how do we hold the tension as well as the importance of those two together? The body politic as well as the telling and the told of the experiences of people in a particular community, and working in all of those levels in between, because people are not devoid of the community, the culture, the organizations and institutions that they are a part of. I think also in the collaboration, we as funders and Robert Wood Johnson Foundation, as Alonzo just pointed out, all of those collaborations of funders, there's no one funder that can do it by themselves. There's no one city or policymaker. Regionalism is just as important as localism is in really helping to shift the needle. I think the second lesson that has really come out is that gaps are systemic, multidimensional, and interconnected. So there are 4 areas that we are primarily focused on funding through the Humana Foundation, and that is food security, post-secondary success, asset security and social connection. And so we really center a lot of our grant making around that, or investments as we like to call them now. And it's with food security. It's not just about access to food or the affordability, but do you have the autonomy to choose the food that you want? Is it appealing to who you are as a community and as a culture? And are we protecting all of the systems around building food in that community so that we are not harming food workers and farmers and all of the systems that bring the food to us in the ways in which we want? Similarly, with asset and financial security, it's not just a matter of have you been educated and are you hired and trained for a job. In the US, particularly, we see that if your neighborhood conditions, if there are 20% of others living around you who are below the federal poverty line, and that is dependent on one's particular household, but if they're below the federal poverty line, more than 20% are below, then your income, your high income, and what you can save and what you can do as an individual is not going to matter. It's really the community and the focus of the community. And similar for post-secondary success. Is it a job that you feel that you're excited to go to and want to maintain being on that job, or do you feel those microaggressions within that space because of how the environment of where you are working? So you might have a job, you might be trained for success, but if you can't show up every day because of who you are or what's happening in your community. So that led me to think that social connection and that idea of not are you isolated in a community or do you have a family member that you can call, but really those macro levels of thinking around social connection, the citizenship that one has in their particular community or institution, the participation and connectedness and belonging. Those are really aspects of closing those gaps, and how do we measure those things in communities as well. The third is Smurf Capital, and we just talked about how communities have an opportunity to really wield power and resources in different ways. And so with the mayor here, with Mayor Khan, there might not be a lot of financial capital that is given, but just that reputational capital of convening is important. And so how do you hold that in your space? What is the social, moral, intellectual, reputational, and or for those funding institutions? All of these things exist as well, not just the financial capital that's able to be given, but so grateful for guys in St. Thomas as well as the King's Fund partnering together and bringing this convening on today. Really, that intellectual capital is being willed in a very powerful way right now. And so finally, these are around visualizing the content. That is so critical to bringing in a democratic way of continuing the conversation. Not everyone will probably come and theorize and be intellectual about the systematic literature reviews that we will do or the health and economic impact assessments, but it is so critically important that they too can be a part of the conversation. And so that has been done through the Health Equity Report, I think, which has been such a powerful example of how do you visualize content and involve community residents and policymakers and academic institutions in ways in which everyone can see very tangibly the health outcomes are here in the leaves of the tree, the root causes or things that are happening in the roots and a little bit beneath the surface, but how do we dig deeper, really, to what those root causes are? So this is an example of how the Health Equity Report is laid out, to where people who really want to dig into the data, they have that there for them, and they can see where the disparities are in the community based off of the GIS mapping that was done. But for someone who's saying, well, tell me more about how education really relates to Alzheimer's disease, and I want to know what I can do about it, there's also a best practices page and how those happen at each of the levels. So very comprehensive way of visualizing content in community. And with that visualizing of content, design of place and the function of space operates within those systems of power. So these are redlining maps, and Alonzo alluded to that. On my right here, you see the redline map from the 1930s. And this was from the Federal Housing Administration in the US. And these loans were made in terms of where federal loans could go for housing. And so that 1930s map that shows the areas in red, those were redlined, and the language from those documents said these were undesirable areas because either Negroes lived in that area, the language that was used in the document at the time, or immigrants lived in that particular community, and so loans should not be given there. The map you see on the far left is one from 2017. So the spaces that were designed in place in 1930s are showing still to have an impact on where, this is a map particularly of death due to diabetes. Those green dots are grocery stores, full-service grocery stores in the U.S. So where individuals can use their federal benefits or their social benefits for food. Those green dots represent within a half-mile radius of where you can get food. If you don't have transportation and you live where you see the purple on the map, you don't have access within, in some of those places, 2 miles to get that food. And so the death rate is higher in those particular areas. Grocery stores are deciding where to put their grocery stores, even still, based off of these 1930 maps. So it's been intentionally designed that our places impact our health outcomes. And so when we just go from it from a diabetes perspective or from an obesity perspective, and we don't get underneath the hood or into the soil of that particular tree and understand really those systems of power and how is this all coming to be, then we might be putting our resources in the wrong places, and we need to dig deeper. So I'll leave you with this picture. It's from a photo voice method. This is another way of democratizing the process of bringing in people to talk, particularly community members, to talk about very difficult situations or how do we change the way that we think about. And this was from a study that I did back in 2014. And there was a young woman, and I asked her, where do you see hope in your community? The same question that I posed to you all this morning. And she came back with this picture, and it was a picture of a swimming pool. A swimming pool? Tell me more. And so she tells me this beautiful narrative about how she was experiencing homelessness. She had to leave university because of her financial situation. She was really not eating as much as she wanted to, and she wanted to maintain not having a child before she got married, but she felt she had accomplished a lot because she was the first in her family that hadn't had a child before the age of 12. So lots of systemic barriers that she was facing. And she said, but you know where I see hope in my community? In this swimming pool, because I didn't learn how to swim until this summer. And her friend pushed her off the diving board, and she tells this story of how he pushed her off the diving board. They were both working at a summer camp in a community recreation center, and she made it back up to the top. She's like, I didn't drown. And so just as I didn't drown in that swimming pool, I know that all of these things around me are not going to take over, and they're not going to drown. And I felt so inspired by her story of resilience and her story of community that brought her to that place of understanding that she wasn't going to drown. But what about that pathway? What are we doing to make sure that recreation centers exist, that she can have money to go to the university, that she will have housing? And so not just the individual behavior, but how do we change those larger systems altogether to where we're really grasping at the root of what the change needs to be. Thank you.